Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Hi, thank you so much for joining us for this episode of Being Well today. My name is Keanne Armstrong and I'm your host for this program. And today we are talking about preparing parents for childbirth and what to do with that new little bundle of joy coming into your home. I have a couple of special guests here with me today, and both of them are from Sarah Bush Lincoln Health Center. I have Allison Masse. She's an RN and she's the perinatal education coordinator, and you're also a lactation nurse. And then I also have Dena Cochran, an RN and the education coordinator. Thank you so much for joining me today, ladies.
Thank you for inviting us.
So this is an exciting time for parents, but it's also a scary time, and it can be scary. So talk to me about what type of education is out there available for parents who are bringing home a new little baby.
We are very lucky in the age that we are at now that there's a lot of information out there, a lot of resources available. Informations, whether it's prepared childbirth classes, there's a variety of locations where you can find books and educational material, libraries, or books you can buy about pregnancy in the first years. Childbirth classes are a good way to start.
Okay.
Learning about pregnancy and labor.
All right. And these childbirth classes, does it go through like everything, or is it for young parents, for old parents? I mean, who is a good candidate to take a childbirth class?
Everyone.
Everyone,
and we've even had like they'll bring their moms with them, or their grandmothers, or their best friend, whoever. But it can be new parents, it can be your seventh child. But there is always specific things that you're interested in learning a little bit more about. So we really invite everybody to get the education so that the anxiety and fear isn't there.
Yeah, that's good to be educated across the entire front of the family, because you know when you bring this little baby home, or more than one sometimes, twins or triplets, who knows how many, then you're going to have the help of family members, so it's good to have everybody educated. So something that I think is scary for new moms is in preparing for childbirth is labor. You hear that a lot, like, oh my goodness, that's painful, I don't know if I can do it. So talk to me about labor and learning about that.
Okay, you want to?
I can start.
Okay.
We encourage, of course, everyone to be educated. So the more you know about pregnancy and your bodies, more we know about pain medication options, more we know about breathing and relaxation, Lamaze techniques, those kind of things decrease that fear and anxiety. Patients wonder how they're going to know when they're in labor. We go, classes cover those kind of things. Lots of books cover those kind of things as well.
Okay. And they'll get a lot of information too from their provider and the nurses that they see there in the office. But then, of course, we offer, well, not just we, but a lot of hospitals offer more classes to learn more things about breastfeeding and labor, postpartum care, infant care, all of those things that really get people kind of worked up.
Yeah.
And I think probably one of our biggest jobs is reassuring.
Yeah, helping decrease that anxiety and that fear. And speaking of fear, I think associated with labor is the pain that a woman...
Of course, it's everybody's biggest fear with labor is pain.
And what do you help to do to, defer that anxiety and bring that back down for women? What do you educate them on?
Well, actually, there's several things. One, education always helps decrease anxiety, which also decreases the perception of pain. We have there's several options out there for women to choose. You can have an all-natural birth or a variation of that. So you can go from nothing and maybe do aromatherapy, massage therapy, visualization. There's many places that offer hydrotherapy. And then, of course, if they proceed on, you can have some IV medication. It can, some places use the anti-anxiety medication, or they might use a narcotic. You also have the epidural option, which I think is fairly popular, and probably a high percentage of people choose the epidural. But also the new kid on the block, if you want to call it that, is nitrous oxide, which everybody knows is laughing gas. And but the thing of it is, no, our moms don't laugh, and no, the babies don't come out laughing. I was asked the question, that's why I'm clarifying. Yeah, a little joke. It's similar to what you have in the dentist's office, but it's a 50-50 blend with oxygen. Your dental offices, it's more of an 80-20 blend. And again, it's not, it's really a nice option between going natural and going, full tilt with like an epidural. Because it's self-administered.
Oh, really?
Yes. The patient actually has to hold the mask to their face.
Okay.
It has an on-demand valve, so if they're not holding the mask to their face, it's just not going out into the air and everybody's enjoying the nitrous.
Everybody's having a good labor.
Yeah. So there, it's self-administered. It does have documented side effects. So far, I've not had a patient experience any of those side effects like nausea, dizziness, that kind of thing.
Speaking of side effects,
yes.
would there be any for the baby?
No, and that's another thing that everybody is really, once they're finding out about the nitrous, there is no documented. And there's been a ton of research out there on nitrous in labor and immediate postpartum, so we're not seeing anything with the fetus or newborn.
Okay, that's good to know.
So yes, yeah, definitely. So California's been using it for like 30 years. Europe has been using it for decades. Vanderbilt has been using it for quite a while, not quite like California. So there's very few places that are offering it, and we're just lucky to be one of those places.
Okay. Well, let's talk about the other side of having a child or children, and is outside of labor, is the cesarean section, because that's scary too for folks who have never been through that and thinking, wow, that's major surgery. How am I going to take care of this baby afterwards? I'm going to be in pain. I can't move. How do you talk to mothers and parents about cesarean sections?
Do you want to?
Go ahead.
Okay. It is very anxiety producing. They're scared to death. Most of them are. And even the ones that have come back for, a second or third section, it's still scary. And basically, nursing staff really, build a rapport with the patient, are there at their side, talking them through, let them know everything that is happening. Again, education, I can't really say that enough, because it just really does take a lot of the imagination out of your mind, and really your imagination can lead you down some pretty dark paths sometimes. So we do a lot of talking, explaining. We're there with them. The physicians, are always around too. And there's not a step that goes by that they don't know what's going on. Right. And there's a new piece of material that's out there that actually a lot of patients are talking about because it's been on the internet.
Yeah, what is
and
that?
It's called the family viewing drape.
Okay.
And so actually it's the actual drape that we would put on for any C-section, except the piece that goes right here in front is clear plastic. And so it's a 2-ply, so you have the clear plastic, and then towards the patient actually is the blue. So when the baby is actually getting ready to be born, the anesthesiologist will lower the blue drape, and they dad and mom both can actually see their baby being born, because a lot of people, when they are having a C-section, that's one of the things that they are really disappointed in, is that they don't feel like they get to be to observe.
Yes, they miss those first
Yes.
moments of baby being born.
Yeah.
And so this was one way that we have tried to make sure that moms and dads are able to
Get that first
get
view of
those
the
first
baby.
moments. That's
Aw,
right.
that's
That's
sweet.
right.
And adding with the dads that can go in, just because you're having a cesarean section, you're going to be with the staff, and we're going to help you and guide you along the way and tell you everything we're doing. But you're not going to be by yourself. We're going to let your partner, whether it's a dad or a grandma or a boyfriend, whoever happens to be there to be your support, you're not going to be separated from them during that time. So you don't have to go by yourself. And a lot of patients are very anxious, but once we get that support partner in there and they can sit down and hold their hand, you can just kind of see them relax.
Yes.
Yeah, it helps to have loved ones around.
Yes. We're good, but we're no substitute for your loved ones.
No. And the other thing about that too, a lot of people have heard, skin to skin, getting the baby right onto mom's chest as soon as, birth is done. And we've really been also using that in the C-section suite too.
Okay.
So as soon as mom's good, baby's good, we get the baby right around the drape to mom's chest, and we do a lot of our stuff, do the assessments and everything right there,
Wow.
so that they can, be part and
Yep.
hold their
Start to
baby. And
snuggle.
that's right. Start that bonding process.
Absolutely. So then once the babies are here and all of that is happening, and then you're thinking about, well, I'm going to be taking this little one home, and all the different things that come into play there. And I think one of the scariest moments was figuring out how to put my son in a car seat, first of all, and thinking I have to drive down the interstate, or a loved one has to drive me home. So what do you educate parents on about car seat safety and learning how to operate one of those types of seats?
Car seat safety has come a long way. Recommendations, regulations change periodically as far as how long that seat has to stay facing, rear facing, when it can turn around, which car seats are right for which ages, and those kind of things. In our area, we are very fortunate here. The police department in Mattoon, and I think maybe is there somebody from Charleston also, who are certified car seat and safety inspectors. They hold some classes where they go over the rules and regulations to help new parents learn those things. If you've ever put a baby in a car seat or helped with multiple babies, there are no two car seats the same. Every single one of them is different and works just a little bit differently. So they will give a class and tell you about them and help you look at your car seat. If you have it, they'll also help you install it into your car and inspect it in your car, so you know that you're driving your baby home safely.
And that helps to decrease a lot of anxiety
It does.
there too, because you know that little one's in safe. So if anything should happen, you've done the best job you can to keep them safe.
Because they're very vulnerable in there.
Yeah, so little, and and those, they've got the pumpkin seats now that you can carry out, and just learning how to use all of that equipment, I think, is stressful.
It
learning
is.
how to put them in. So it's good to check with your police officials in your hometown and make sure that they can help you with that as well.
Yes.
So let's move on to another thing that I think is stressful for new mothers is breastfeeding. So talk to me about that.
We are fortunate. We have a lot of great staff who have been helping mothers learn to breastfeed for years. Anybody who tells you that it's the most natural thing in the world and it's just going to go, it's just going to be a dream, is lying to you. Sometimes it takes some work, and that's what the staff is there for. They're there to help you. They're there to make this a success. Probably every mother's biggest fear when they begin nursing is is the baby getting enough to eat? That's probably the number one,
because
the
you
number
can't
one
see how
concern, because you
much.
don't know how much they're. It's not like a bottle where you can see that they've taken, an ounce or two, an ounce and a half of formula. So we educate everyone that, if the baby is having wet and dirty diapers, and we can give them charts for what day of life they should be having how many wet diapers and how many dirty diapers. If they're meeting those criteria, then that's how we know they're getting enough to eat.
Okay.
Sometimes they have some dissatisfaction. They're ready for that milk to be in. That colostrum is the first milk that comes in. Not a lot of it, but it's super rich. It's super high in all of its nutrients and fatty acids and all of the
good stuff.
that babies need. And parents worry that she seems like she wants to eat all the time. Is she getting enough to eat?
Right.
She is. She's just ready to get through colostrum into actual breast milk, and she's wetting and dirtying her diapers. She's a healthy newborn.
Yeah, she's getting what she needs.
And I think also that, as adults, we eat 3 meals a day, maybe a snack here or there, whatever. You have to rethink that with an infant, because if you think of their little tiny tummies that hold a teaspoon, that's it.
Yeah, that's not
so
very much.
that's
The size of a
nothing for
cherry.
us.
Yes, the size of a cherry is what we'll tell mom.
Yes, but that's exactly what that baby needs. And so, when they're going on and really worried about what the baby's getting, and I try to compare colostrum with a power drink. Okay. So you drink a power drink and it gives you everything that you need. Colostrum, it's not very much, but it is huge in nutrition. And so it gives the baby what he or she needs in that small amount, because they can't hold 20 ounces,
Right.
In their stomach.
Okay. Now, talk to me about this, because I think this is another stress for new mothers, is maybe the ones who are having a hard time producing breast milk or feel like they're failing at it, and maybe they're thinking, well, I can't produce that for my little one. What do you talk to new mothers that are having a hard time with that? What do you say to them?
Well, the big thing is reassuring. If there truly is an issue, then you pretty much have to individualize how you're going to, try to proceed with that patient. And it may come down that she may need, to pump after she's tried to nurse, because actually nursing is the ideal stimulation to produce breast milk. But if there's some issues going on, you try that first, and then try pumping and then feeding that to the infant also.
Okay.
As a last resort to somebody who wants to, exclusively breastfeed. We may have to talk about supplementing with some formula.
Right.
And that's a very touchy situation with people wanting to exclusively breastfeed, which is totally understandable. But on the flip side, we also have to make sure the infant is getting
Right.
the nutrients
Sometimes your body just doesn't want to do what you want it to do.
And there could be multiple issues. I mean, you could have a, congenital anomaly in the breast anatomy that you're just going to make so much and that's it.
That's it.
And that's one thing that, when you're going to your prenatal visits with your provider, they're looking at that also to see if there might be any, issue later on.
Okay.
But I think a lot of it is reassurance.
A lot of it is just reassurance.
Yeah. And education.
Right.
Yeah, they just need to know that the baby's getting enough.
Yeah.
Definitely.
All right. Well, that's good to know as well. And then coming into play with keeping a baby healthy and clean and all those different things, it's a lot to learn. Like, how am I supposed to bathe this newborn, because the bathtub seems awful big. So what are some different things that you do to educate new parents on bathing and diapering and just sort of the general things that you need to do?
Well, initially in the hospital, we're going to work with mom and the support person to make sure that they do know how to change a diaper. Talk to them about cleaning little girls from front to back, not back to front. we'll talk about cord care and taking care of that little umbilical cord. A lot of times patients are very excited about it, or they've gotten this new baby bathtub that grandma got for baby, and they're ready to use that little tub. We really recommend that until that cord stump is dry, that they continue to do just sponge baths. So we'll do a sponge bath in the hospital, and we'll wash the baby's hair in the sink and make sure that we include family in that so that they know how to do those things. There are tons of products on the market that are ready for newborns for baths. But the main thing is that they're never left alone. We always emphasize safety whenever we talk about newborn baths. Once we get past the sponge bath section, that there's no unattended babies in a bathtub that could lead to disaster.
Right. Yeah. And speaking of safety as well is SIDS. We're concerned about sleeping and SIDS prevention. So talk to me about that as well.
Basically, again, it's a lot of education, and we also make sure that we do education before discharge. So we know they're getting it several times.
Back to sleep is our big push, and it's kind of the big nationwide movement. It's called Back to Sleep, which we want babies sleeping on their backs.
And so, another piece of that is everybody loves putting together the nursery and having all the frou-frou stuff, which is lovely, except inside the crib. You shouldn't even have the bumper pads. And I know that just makes a lot of people just
breaks grandma's heart, because grandma did that with her baby. Grandma did that with all the babies, all those babies.
It is. And all the stuffed animals and the little pillows. Literally, there should be nothing in the crib. A sheet on the mattress and the baby in, I call them halos, but what's the word?
Little sleep sack.
Yeah, the sleep sacks.
Okay.
Yeah.
Not covered with lots of blankets.
Nope. Because they can get that up around.
Yeah, so being careful
face.
of what you're putting around the baby when it goes to sleep,
having them too warm. Temperature is another one. Sometimes you'll see moms bring that newborn baby back in for their first visit to the doctor's office, and moms come in shorts and a t-shirt, and baby has a onesie and a sleeper and a blanket and a hat, and they're too warm.
Yes.
So we tell parents, dress the baby kind of the way you would dress.
Yes.
So if you have on shorts and a t-shirt, baby probably just needs a little onesie and maybe a lightweight blanket. We don't want them to be too warm. That's another part of the SIDS prevention. No smoking around infants at any stage.
Right.
Even leaving the room, even if they'll say, oh, well, grandpa goes outside and smokes. Well, then he comes back in, he picks that baby up. Where's he put that baby? Right on his clothes, right where he was smoking from. So we need to keep babies in smoke-free environments and with smoke-free.
Definitely. And a new thing that they've come out that I was just reading is that they are not recommending that infants are left in the pumpkin seats or the car seats to sleep.
Okay.
Because, if they can get all crunched down, they'll block their airway.
Yeah, that's not
So
good.
They can't control their heads yet.
So once
exactly.
again, lay them on their back.
Yes.
Okay.
Lay them on their back.
All right, we've got just a couple of minutes left, and I know there's so much to cover in these types of classes and to educate parents and so forth. So there's different things like siblings, how to talk to maybe siblings that are expecting a new brother or sister, or just the different things that you might need for a nursery. So what's some resources or different things that parents might be looking for that can help them before they get to take a class?
Before a class?
Yes, before a class or with a class, either way.
Well, I think that there's again, it's reading, and there's a lot of books out there on talking to your children, if they're old enough really to understand about the new infant that's coming along. Definitely, we have the Big Sister, Big Brother class that is very popular.
It helps them to feel like they're a part of this too. They're not being replaced.
Right.
They're being added. This is an addition. It's a welcome addition, but it's teaching them safety, just basic safety things from babies about how we support their heads, and things like that are important for big brothers and big sisters to feel included.
All right, and one last question. We've only got about 30 seconds. When should somebody sign up to take a class like this? Third trimester?
Early third trimester, yes.
All right.
But really, any time that is convenient for their schedule.
Just as long as they become
As
educated.
long as they become educated, that's right.
All right. Well, thank you so much for joining us today. We covered a lot of information. We hope this episode of Being Well has been helpful to you if you're a new parent expecting a little bundle of joy, and we thank you for watching.
Production of Being Well is made possible in part by
HSHS St. Anthony's Memorial Hospital, delivering compassionate care close to home. From advanced surgical techniques and testing to convenient care for your family, we promise to make a healthy difference each and every day. St. Anthony's, together, we are better.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center.